And now on the line is Louise Lunney. Louise is a researcher with the Health Promotion Research Centre in the University of Galway. Louise, welcome to Near FM.
Thanks very much for having me.
Okay, Louise, I got in touch with you for this interview as I was delighted to read about most of the research you and the Health Promotion Research Centre in Galway published earlier this week in your Health Behaviour in School-Age Children Trends Report for the year 2022, and to read the article on the journal.ie about the comparison of the statistics to 1998. I have to say, first of all, Louise, that I love Galway City, although I have never visited the University of Galway. Can you tell me, first of all, Louise, more about who the Health Promotion Research Centre in the University of Galway are, and the kind of work that you do every year?
Yeah, of course. Yeah, so I'm based in the Health Promotion Research Centre here in the University of Galway, and we run the Health Behaviour and School-Age Children study from here. And the study has been carried out every 4 years in Ireland since 1998, and we most recently collected data in 2022. So that was the seventh cycle, or the seventh time that we collected this data in Ireland. So yeah, we carried out the survey and the analysis in the Health Promotion Research Centre. And this trends report that we launched this week is covering that period from 1998 to 2022. And having collected the data over this period of time, that allows us to monitor the health of children over time.
Okay, just before, I have one more question about your centre first. Do you yourself and the other people in the centre work full time on this report all the time, or do you do other work as well?
Myself, I'm working full time on this study, so I've been involved in the study since the beginning of this cycle, so since 2022. But there's a lot of other research that's carried out in the centre. So there's studies on sexual health. There's studies looking at food and food marketing to children. There's studies on mental health, and there's a wide range of other research taking place in the centre as well.
So you're probably the centre yourselves are probably an international centre of excellence, are you?
Yeah, we are WHO, so the World Health Organization Collaborative Centre. And also this survey that we carried out, it's conducted in collaboration with the World Health Organization Regional Office for Europe. So the HBSC study is also carried out in countries across Europe, Canada, and Central Asia. So there's a network of over 50 countries involved in the HBSC study.
Okay, that's cool. Okay, Louise, before we talk a bit about the news in the report that is not so good, can you give me a bit of a summary, please, on some of the remarkable progress that has been achieved over the last 20 years?
Yes, so we have seen some positive changes and progress that has been made. We've seen some improvements in certain health behaviours, so like soft drink consumption, toothbrushing and seatbelt use. So for soft drink consumption, we've seen very large decreases in the number of children who are reporting daily soft drink consumption. And that's gone down a lot since 2022. We've also seen increases in children who report brushing their teeth more than once a day, and there we see big improvements for boys especially. And there's also large increases in the number of children who report always wearing a seatbelt when travelling by car.
I find it remarkable. What stuck out to me the most were the figures on cigarette smoking, alcohol, and cannabis use. I find it remarkable, like how the figures have gone down, like, how the rate of numbers of young people doing these drugs has gone down over the years. It's remarkable, I think, isn't it?
Yeah, no, it really is. We have seen significant reductions across the substance use indicators, so cigarette smoking, alcohol and cannabis. There's very significant decrease in those reporting being current cigarette smokers. So that was 22.6% in 1998, and that's down to 4.7% in 2022. And then those who report having been really drunk has also declined. as has those reporting cannabis use in the last 12 months.
Yeah, I find it fantastic. I'm just a bit curious though about cannabis because, like, at the same time, there does be a lot of reports in the media every year saying that, like, a lot of young people smoke cannabis. So I'm just wondering, like, is it kind of a thing where people smoke after they leave school? Do you know anything about that, do you?
Possibly. The survey that the age range we're looking at here is 10 to 17-year-olds. So that's the age group that's included in the report. But I'm just not sure if the exact rates for, after leaving school or for older adolescents.
Okay, yeah. No, I'm just a bit curious about that. Okay, the report is great, and I'd recommend to our listeners listening to us today to read up on it or to read the article on the journal.ie about it. But Louise, not all of the statistics in your report paint a positive picture for young people in Ireland today. Can you tell me a bit more about the kind of negative side of your findings?
Yeah, so one of the more negative findings from the report we've seen decreases across mental health and well-being indicators. So we see that more young people report feeling low, fewer report the high life satisfaction, and there's also fewer reporting feeling happy with their lives. So we've seen large decreases across these indicators, and especially for both boys and girls, but especially for girls. Yeah, so I suppose that is the bad news that stands out from the report is this reduction in mental health and well-being. But we do see that this isn't unique to Ireland, and this is happening across Europe. We can see from the way the studies carried out in other countries, they're also seeing these changes. So it's important that more is done to address these issues.
Yeah, I find, as I kind of already mentioned, but I find that the huge reduction in the number of young people smoking cigarettes and drinking alcohol or getting drunk regularly over the last 20 years, because I did my leaving cert in 1998, so I remember those days,
Okay. Yeah.
So I find the difference since then like fantastic.
Yeah.
It is great news for across the health community in Ireland, isn't it?
Yeah, no, it's that is a big positive that we've seen from the report. Another, I suppose, positive finding we found was that children now find it easier to talk to their mother and father about things that really bother them, and we've seen a dramatic increase when it comes to communication with fathers. So in 1998, 47.4% reported that it was easy to talk to their father, and this is up to 70.2% in 2022. So it shows that father-child communication is improving, and this is a really positive change as well.
I noticed that statistic as well from your report. Okay, Louise, it's great talking to you on Air FM. Thanks very much for coming on the show anyway,
Thanks very much for having me. Thank you.